All right, good afternoon, everybody. We are doing our regular update in our battle against the coronavirus here in Kentucky. As we have talked about on previous days, we are seeing an escalation here in Kentucky. And while it has not reached the levels in certain other states, it is just so critical we do the right thing right now to prevent what has happened in other states from happening here. And I know I've tried to give some different examples based on news stories and others and what we're seeing in those other states, but today I got a more grim report. Now, my family has been involved in the funeral home business. It's now extended family, so we still get reports from that industry. And today I learned that there is at least one casket maker that is having every single bit of its capacity sent to Georgia and Alabama and Texas right now, not on the delivery trucks that they're used to using, but on 18-wheelers. Let's make sure that Kentucky doesn't end up in that position. What we're dealing with is life and death, but here's the good news. We are taking the type of aggressive action that should work. And if we can band together, get most Kentuckians wearing some form of facial covering, have that social distance, we can prevent it from happening here. And we're acting faster than some of our companion states. These are two that I talk to regularly. Ohio and Indiana have now followed our and other people's lead in requiring facial coverings. This should tell you that the step that we took is the right step, given what we're seeing, but also this is going to help. The fact that two neighboring states are also doing it should make Kentucky's response more effective. These are two governors that I respect. I'm glad they took this step. We had talked about it on different occasions. They obviously deal with different constituencies than I do with their states and the differences. But this now region, Ohio region, requiring facial covering should help all of us, and it should show you that there's no political division in what is the right public health response. Between myself and these two governors, you have two Republicans and a Democrat, and we all agree that one of the most important things we can do right now to stop COVID is for people to wear a facial covering. This isn't a Democrat or Republican thing. This isn't a political thing. This is a public health tool that is the difference between life and death. This is going to be the number one thing to determine if we can keep our economy open, and this will be the best tool to try to get our kids back into school. Let's make sure that we do it. Because as we see in today's numbers, we are still at an elevated rate. They are thankfully a little bit lower than yesterday's, but still show an increase as you look back, especially 2 weeks ago. Today we're reporting 518, that's 518 new cases of COVID-19. That brings our total number of cases to date after we remove duplicates to 24,540. So again, when we think about 518 cases and we remember the mortality rate that we deal with here in Kentucky, even being better than most of the country, that's a high number. That means we're going to lose a lot of people. So going forward, let's do what it takes to cut down on these cases, to get to a new plateau and then to a new decrease. Today's 518 positive cases come out of 10,953 total tests. That brings our total number of tests administered to 560,161. Now, because of the way the reporting works, positives coming in differently, we can't say that these 518 positives were tests taken on the same day as all the other negatives. And that's a data issue that every state deals with. But what we do is our very best in when we get the data to give as much accurate information as possible. Our positivity rate, 7-day average, and those are based on our actual numbers where we're able to use direct numbers that come in from us. Our positivity rate's gone up. It's now at 4.92%. That is a concern, and it shows it's not just an increase in testing. It's more people that are being tested are showing positive results, which is what we know. We're seeing more cases all across America. We know the coronavirus is increasing. We know that it's spreading, and that's why we're going to do what it takes to defeat it. Today, our total number of Kentuckians that are hospitalized because of the coronavirus is 603. That's up from yesterday. Our total number of patients in the ICU, Kentuckians in the ICU, is 145. Again, that's up, I believe, from yesterday. Our total number of patients have recovered, 7,000. Again, that number is as accurate as we can get it, but those are only reports that we get back in. I believe the number of recovered is actually larger, maybe even much larger than that. But as you're seeing through the news, not everybody's experience in recovery is the same. Some may recover fairly quickly. Some who are asymptomatic will test negative later on. Some are still dealing with the residuals of this even months later. So it's a nasty virus. And even if it's affecting somebody that the statistics say it probably won't kill, it can really harm them, and we still don't know moving forward what type of long-term effects it'll have. So let's try to make sure that fewer people get it and that we don't spread it to other people. New cases by county: Jefferson 83, Warren 49, Fayette 34, Kenton 24, Boone 22, Barron 20, Scott 19, Hardin 15, Campbell 12, Laurel 11, Perry County 11, Bullock County 10, Franklin County 10, and everybody else is in the single digits. But again, the numbers in these different counties can add up quickly, especially because we see it now spreading really in clusters. I did see a report the other day that they believe that an asymptomatic person spreads this virus to at least 2 to 3 other individuals, so you see how quickly that it can spread. All right, today we have 13 kids under 5 that have tested positive. We are tracking this because the percentage of the total tests for kids in this age group are going up. Now, it could be that we weren't testing that many kids in this age group before, but this is still really important data that we need to know. They're in 7 different counties. Youngest one, there are 2 that are just 5 months on this list. We certainly hope for the type of outcome that we've seen in most others of this age, and that is a recovery and hopefully very few symptoms. Being a dad with kids that have gone through much less, that's what I would want for absolutely everybody. Today we're reporting 3 new deaths to COVID-19. A 49-year-old woman from Simpson County. I know that there are some underlying health conditions in this one, but 49 ought to hit people pretty hard. A 69-year-old woman from Allen County. Again, we are seeing a lot more people in their 60s recently passing away from this virus. And an 81-year-old man from Webster County. So I believe there's at least a couple of new counties there that are experiencing loss. Let's remember those green lights. Let's remember those bells at 10 a.m. We're gonna be at this a while longer, and there's going to be more loss out there. And I think that the people, the families that lose their loved ones 4 months into our fight against this virus deserve our support as much as those that we lost earlier. Our total number of deaths is now 677. Sadly, I think we need to expect that we will see in the coming weeks a significant increase in that. More cases times the mortality rate, even if we can push it down some, is going to equal more deaths. And what we see is an increase in cases before you see the spikes in deaths. So we know that this is a life and death issue. The fewer people we can get infected, the fewer people that we will lose. So let's keep up that fight. Ethnicity breakdown is about the same as we've seen just of total cases. Again, a little over 15% of cases in our Hispanic population. And then when we separately look at race, 78% white, 12.43% black or African American, 5.87% multiracial, about 3% Asian. And then when we go to our deaths, and we'll post all this online, the death rate on Hispanic individuals is about the same percentage they make up, that group makes up of the population, whereas again, when you look at race, our black and African American population almost twice, thankfully now a little less than twice. For a while it was a little more of percentage in deaths as compared to population. Long-term care. We continue to see some new cases in long-term care, though from the rate we were seeing earlier, we do think that this is stabilizing, but this is, as long as we have COVID-19, this is going to be a fight. And it's a fight to protect those that are most vulnerable. 31 new residents have tested positive, 2 new staff, and 2 new deaths. And remember, these aren't new numbers from what we report in the given days. It's that we go back and determine from those numbers how many of the positives were residents here or how many were staff. But look at that staff number. I mean, that shows you that this virus is significantly impacting staff in our long-term care facilities. And guess what? They show up anyways to help the individuals in those facilities. That's heroic. It also says that we need to make sure that we have a good testing program for them, which we are implementing now, to make sure that they know if they are positive so that they don't take it into a facility. And given that amazing work that they do, we can make sure that they stay healthy, and if they need help, we can give them help. Because let's remember, we've lost 3 staff members to this virus. We don't want to lose anybody else to this virus, but it certainly hurts when it's someone that shows up to help someone probably already and knowingly suffering from COVID-19. Unfortunately, we have some increases in our Kentucky child care facilities. We have 6 new facilities, bringing it up to 36 child care facilities that we know of that have at least 1 case associated with COVID-19. It doesn't mean that they are a cluster, but this is the way we report our long-term care facilities. So it's 5 extra staff and 3 additional children. But there's good news out there. You know, everything that we give on the report right now, because we're still waiting for the steps we've taken to have their impact, knowing that when you take a step, it's going to take 10 to 14 to 16 days to show up in the numbers. There are good signs out there. So I want to start with today's social media, and the first one is a pretty special one. After being hospitalized for 116 days in a Louisville hospital, Rhonda King, who's 56, has gone home after recovering from COVID-19. Rhonda was admitted to the hospital on March 27th and was put on a ventilator in a medically induced coma. Despite this, her husband called 3 times a day so she could hear his voice and he could remind her of her strength. Rhonda began to improve after receiving a plasma donation from a COVID-19 survivor. And there are multiple heroes in this real-life story. After 3 months in the ICU, 3 months, Rhonda entered rehab at Baptist Health. Yesterday, she went home. Rhonda thanked those at the hospital who cared for her. Her husband, Anthony, who she met 41 years ago, that'll be 1978, said those in the hospital were God sent. Rhonda is now looking forward to spending time with family, including her 4 grandchildren. This is a story of triumph. It's a story of compassion, of faith. I hope it reminds people of the seriousness, but also celebrates those that are fighting this battle and those that are helping them. And just, if you unpack what happened here, you've got our frontline heroes in the hospital and the rehab center. You got whichever individual donated the plasma there. You've got her husband calling every single day, not knowing whether she can even hear his voice. And then you got her putting up that fight that it took to defeat this virus. Those are special stories, and we don't want anybody on a ventilator for 3 months, but we want more positive stories of someone ultimately has to go through that. All right, this next one is just about everything we're asking for. This is a couple on a staycation, meaning they have not traveled to any of those states that we are concerned about because of the high positivity rate. They are also wearing masks in their picture. This is, I'm not kidding you, this is how we beat COVID-19, and it should tell you that while it is an inconvenience, it doesn't have to be that hard. They are on a form of vacation. That's Frankfurt in the background. They're on a form of vacation. They're finding some joy in what they're doing, and they're following the rules to where we can beat COVID-19. I love this next one because it shows, again, our kids don't get down. They do what it takes. This is a kiddo who is at a doctor's appointment, doing what it takes to stay safe in that environment. And let me say, if you've been putting off doctor's appointments, please don't. We believe that it's safe now. The facilities have so many different safeguards in place, and we want to make sure any other health conditions don't get out of hand. So make sure that you go see your doctors. Make sure that you get the care that you need. We don't want COVID to result in losing you to something else or your health deteriorating. I would tell you if I didn't think it was safe. It is. Please make sure that you go get those checkups. All right. I love this next one too. This is a 100th birthday at Cedar Creek Presbyterian Homes. And this is for Geraldine Branham. This was Monday, July 20th. This is in the midst of COVID, doing it right, celebrating a 100th birthday. So I say every day different reasons that I wear a mask. Today, I wear a mask for Geraldine, making sure that COVID will be over by her 101st birthday. I believe that, and I can't wait for her to have an even better one then. And I'm just going to assume that chain is the social distancing line to make sure that everybody stays that 6 feet away. Next one's a little personal to me. So some of you might know that I hold a distinction I'm pretty proud of. I'm the first Kentucky Governor Scholar to ever serve as Kentucky's governor. It's a program that changed my life. I wouldn't be here. I don't think I'd be comfortable in my own skin without this program. It made a long-lasting impact on me. And COVID has made it really challenging, knowing that these programs are out there and what will happen. I got to tell you, this program, I think, can serve as a model in how we try to get back to a new normal. These young leaders, because they are all young leaders, have adjusted. I've now had a Zoom call with every single GSP class, which is much smaller, and they go back into their communities and serve as an amazing role model, not just to young people, but to all people, about what we need to do to fight this virus while also making those connections that, listen, I still have today. One of the top officials in my governor's, my attorney general's office, Gretchen, who did such an amazing job, was actually one of my RAs when I was at Governor's Scholar. So she remembered that, and then she reminded me. Last one. It's what you see every single night in Frankfurt. And this is what I see every night before I go to sleep and every morning when I wake up, because I haven't gotten up after sunrise in a long time. This is our Capitol lit up green in compassion. It is a reminder of our battle, but it is also a reminder that we're going to get through it, and we're going to get through it together. I'm going to ask Dr. Stack to comment on where we are now, and then I'm going to give some budget news. And our budget news has a surprisingly good piece in it, and then it still has the very grim prediction for what is coming. But I'm excited to give a little good news today once we hear from Dr. Stack on our need to continue to wear these and do what it takes.
Thank you, Governor. Good afternoon, everyone. I am going to remind people what we need to do, but the Governor also gave me the opportunity before to share some thoughts about some of the other items that I thought might be important. So I have a grab bag of items to update you on tonight. So people ask about drugs and therapeutics. So remdesivir is still one of the few drugs that has been felt to potentially be helpful. It's still an experimental treatment. The federal government had secured a donation from Gilead, and we have been distributing that out upon physician request in Kentucky. It's now shifting to a purchase approach, which requires a fair amount of logistics and complexity. It's difficult to convey just how much has been asked of state and federal government and local government, but I'm thinking about the state level because that's where I reside right now, trying to figure out innovative ways to get these things accomplished in short timelines. I want to thank, though, whenever I can, the partners we work with, and in this case, I want to thank the many hospitals and the Kentucky Hospital Association, because they are working with us on a model so we can ensure we get 100% of the drug that the federal government has allocated to us into the state, so we don't leave anything unused in trying to help Kentuckians who need the treatment. So thank you to the KHA for their help and their partnership. We can't get these things done without these public-private partnerships, and there have been many of them. On data, it's imperfect, it will stay imperfect, it will forever be imperfect. I and we commit to give you the best data we possibly can. We've had a lot of questions lately, we always do, but about how the 7-day positivity rate for testing varies. My response on all of these is we'll continue to be accountable and transparent and share how we calculate things, but I and the department I oversee at the Kentucky Department for Public Health are the repository for the official data on COVID-19 for the state of Kentucky, and I don't know how all the other sites calculate their numbers or why they vary. The official numbers come from the state of Kentucky about Kentucky. For deaths, I want to share a thought. There's been comments over time about an extreme example. If you're in a car accident, you have COVID, are we going to say you're a COVID death? The answer is no. Your death will be categorized as an automobile accident. We have a committee that looks at death certificates that are questionable as far as the cause of death, and they've decided today to remove a number of COVID cases that were listed on their death certificates as COVID related, and in their review of the information have determined that those deaths are not appropriately coded as COVID. So this is an instance where it ties into the data when the CDC will report a higher number than us because they'll get an official death certificate, but our committee, closer to the data, has made an informed decision that we are not going to include these deaths, this small number of deaths, as COVID related. We're committed to being honest and open and trying to be as credible as possible so that if we say it is COVID related, we believe coronavirus contributed to that person's demise. Hospitals, people ask and share concern about, at times, are we trying to make this sound more alarmist than it is? Well, these states around us that are struggling more and earlier and have a higher and steeper climb on their curve, so Georgia and Tennessee, and of course Texas and others, I had report from at least one hospital that their partner hospitals, the chain they're part of, that they are pretty much full in Nashville, Chattanooga, and multiple places in Georgia. And in fact, we have apparently in at least one hospital received transfers from those other states into the state of Kentucky to help their sister hospitals in other states that are suffering more. It's real. We're committed to helping fellow Americans, but we've got to keep capacity for Kentuckians too. It's going to be difficult, and so your actions are going to make the difference for how bad this gets. And the last two things, testing. We have worked heroically to increase testing. We don't have enough still. Not everybody can always get it as quickly as they want, but the governor either has announced or will announce here shortly over 10,000 more new tests today. We have come light years from where we were a couple months ago. I want to emphasize for everyone listening, though, we cannot test our way out of poor decision making. We can't test our way out of bad judgment. You don't solve an infection with a test. You prevent an infection with a mask and with social distancing. So as much as we will continue to work very hard, and the governor's made it very clear it's on my top list of things to do, to expand testing as quickly and as much as I can in partnership with the rest of government and the others with whom we partner with. If people don't take steps to self-isolate, to wear masks, to socially distance, we will not be able to keep up with testing, and we'll run out of materials nationally and in the state before we ever meet the need. Please do the interventions we ask you to, because that's how we don't run out. And then the governor mentioned this, but I want to emphasize it. If you feel you need medical care, get medical care. Go to your doctor, go to your primary care office, get medical care. They're there, they're ready for you. We know that there are other needs that when we asked people to stay at home, you hunkered down and we kept the curve flat. You have to take care of your other medical needs. And I'll emphasize at least one or two right now. One, if you have a child who's vaccination age, get your child into the pediatrician, please, to get your vaccines. We don't want to have children have consequences from preventable illness because they didn't get their vaccines. Please make sure you get your children in for their vaccines. And the second thing is, if you think you have a medical or surgical emergency, if you think you have a stroke or a heart attack or appendicitis, do not hesitate. Go to the emergency department if you feel you have an emergency, or communicate with your doctor directly and seek their guidance. You need to be able to go get care. The hospitals are much better prepared now. They know a lot more about how to keep people safe. They have better supplies of equipment. Please do not delay getting care if you need it. We can control this. Our curve is going up. It's going up steeper than we would like. The governor's announcing much bigger numbers than we had hoped over the last week or two. But let me tell you, whether that turns into a little hill, relatively speaking, or a big mountain is entirely dependent on the actions of Team Kentucky. We can blunt this curve just like we flattened the first one. It's not too late, and hopefully the steps we've taken since July 5th have helped that, and we will see next week if that's the case. But we're in this for the long run, and I'll tell you, we're all tired too. This is not easy on anyone, but we're committed to working with everyone in Kentucky to keep as many as we possibly can safe. And I thank you for all you've done, because it's made a difference. And if you have any doubt about that, there's plenty of publicly available data sites that show that Team Kentucky, this is one time we were really at the top of the pack for public health, and we've done good together. So thank you, and thank you, Governor.
As we know, the coronavirus has impacted just about every area of our lives, of our businesses, and also of our budgets. But today I've got a little piece of good news, and then we still have a major concern going forward. You may remember that the Consensus Forecasting Group, we called in, we had them look at the current fiscal year that we are in. And I believe that was on May 22nd, they projected a $457 million shortfall. Well, since that day, our executive branch cabinets have been working very hard to cut expenses, and I'm pleased that we have had significantly higher revenues come in, and we believe even more will come in by the end of this week when we close the books at the beginning of next week. The deadline to file taxes was about a week ago. That deadline was moved from April 15th to July 15th because of the pandemic, and so now we have a much clearer view of where we stand. Now, this is preliminary. We don't have all the numbers in, but when the books close once and for all next week, I actually believe that I will end the first fiscal year that I've been governor without a shortfall whatsoever. To date, with some collection tax payments still to be counted for the rest of this year, general fund collections are at a total of $11.46 billion. As of today, and we have much more coming in, we're just a little $4 million in the red, and we expect, in fact, to be outside of that. So here's what I expect from the end of this fiscal year. No budget cuts to K-12 education, post-secondary education, health, and public safety. There had been some dollars that we had asked for our public institutions, our colleges and universities to hold back. They're going to get those funds, and I'm very excited about that. No cuts to the judicial or the legislative branch. So let me repeat that. It means no cuts to education, health, public safety, or the judicial or legislative branch in the budget that we just ended. We would have been paying for that going forward. We also expect to increase our rainy day fund, the Budget Reserve Trust Fund, by over 18%. And one last bit of good news is due to higher lottery revenues, need-based student financial aid will receive another $15 million above what we expected for the year to come. Now, I know there's people out there thinking about taking a gap year, about not necessarily moving forward with their education in the midst of this pandemic. We need more of you to get that higher education, to get that skilled trade. We need more four-year college graduates here in Kentucky. We need more people with a skill and a trade out there. I would highly encourage you to make sure you are taking advantage of these programs with historic amounts of aid out there. Right now, we can be making the investment in you that will pay off for our Commonwealth and for you and your family or your future family. I believe I saw the other day some statistics where during this pandemic, people without a college degree have lost their jobs at 2 times the rate as those with one. And so making sure we get a more educated and skilled population is one way that we also become stronger in that if we ever see a pandemic like this again, we will not be hit as hard as we have been hit. So I want to thank our state agencies. I asked a lot of them. I know when my dad was governor, I think he was asking them to cut their budgets just about every month. But in my first fiscal year as governor, I asked them to reduce their spending by 1% in the last 2 months, just in the last 2 months. And they did better than that. We'll have the official numbers, but they did better than that. They held back on hirings, they cut back on discretionary expenses, they stepped up and went above and beyond, and that was necessary to get where we are today. So a little good budgetary news. As you remember, our road fund also came in better. It doesn't look like we're going to have any budget reduction in that last year's road plan. And for the first time in 2 months, we actually did what's called a letting, accepting bids to do road work. And while that's good, that's from the last fiscal year. This current fiscal year that we are facing does look to be as dire or likely as dire as what we believed it would be. Our fourth quarter general revenues, April through June, have declined by almost 8%. That's the worst fiscal quarter since the Great Recession. Road fund revenues, April through June, also declined. So looking ahead, while we will need a new estimate, the last estimate is that we have is almost a $1.1 billion shortfall in the year to come. Without federal assistance in either a new CARES Act, providing direct budgetary assistance just like they did during the Great Recession, or Congress changing one of the last CARES Act and giving us more flexibility to use past funds given to us directly in our budget, we will be looking at, I believe, the largest budget cuts in our history. Now, I hope that what happened in this last fiscal year has a chance of happening going forward, but we know what we face moving forward without federal assistance is really rough. And who pays when that happens? Well, the vast majority of our budget is our health care, our education, and our corrections costs. And the corrections costs are really hard to impact in any given year. So who pays when we don't have the funds we need? It's those that need us the most. And at a time when we're trying to get our kids back in school and at a time when we need to be healthier than ever, it's not the time to have cuts in those areas. And I'm going to tell you, it's never the time to have cuts in those areas. Those are investments in a better, healthier tomorrow, and every investment we make in those areas pays off in future budgets. But our revenue and our budget office would tell you the same thing that I've been and that Goldman Sachs is telling you. The biggest threat to our budget moving forward is COVID-19, is people not wearing a mask, is people not doing their part and causing more business shutdowns. It's us not getting control of this and having to do what the White House has suggested and reduce restaurant capacity to 25%. A lot of people will get laid off again because of that. We don't want to do that, and it is preventable. It's closing bars, it's doing other things that they talk about. So do your part. Do your part. Our funding for education, our funding for healthcare, our funding for so many important areas that are critical to everybody, to the roads we drive, to the lives we lead, depend on us. And I'm not sure in the past, it's not just other people's lives that are in our hands. It's truly us being able to impact the resources we have to address the needs that we have. So I'm asking everybody to do their part. All right, we will open it up for questions. I've got a bunch of people here in the rotunda with us today, and I've got a couple that have been sent in by the outside. I don't remember which side. I started over there yesterday. So, Debbie.
What was that shortfall projected in the next fiscal year again? What would the impact be?
So the last estimate that we had is $1.1 billion, and we have ranges of cuts with and without SEEK, because SEEK is such a large part. You always do both of them. But I believe that the smallest potential cut would be 13% or 17%, and then I think it goes up close to 30. But let me get those numbers from Commissioner Hicks. But they'd be the single largest budget cuts in our history. Now, if the federal government would do what they did in the Great Recession, which helped that recession not last as long, the initial amount that Kentucky got to help with its budget during that was about $900 million. We could close that other piece without causing the huge amount of pain that we're otherwise going to see here. So if we're willing to provide that type of help just during a recession when the economy is struggling, surely we can in a pandemic. All right, what is the status of the field hospital at the Kentucky Expo Center? It is there. It is turnkey. It is ready to go. We'll just need about a week to get it up and running. Is it staffed daily? No. We have some security out there that just ensures that it is still there when we need it. The daily cost of the facility to the state, I believe, is only rent that we're paying to the Expo Center right now, which is a state asset that is losing money right now because we can't do all the things that are otherwise out there. The main cost that we had that we eliminated was the partitions, was putting up the pipes and the curtains, which we can do again, but that was costing us, I think, a weekly amount that within the budget overall that we have of COVID doesn't seem like a lot, but we wanted to make sure if there was any cost avoidance that we would take it. Lawrence.
8.9% positivity rate. Is that the highest we've seen so far? And what does that tell you about the future?
The question is the 4.92% positivity rate, is that the highest we've seen? That's the highest we have seen at least in the last month or to 2 months when we've had sufficient testing, I think, to get a good overall number. Now, I'd have to look back. Remember, when we just had a limited amount of testing right in the beginning, we were telling people, only go get tested if you think you actually have it. And so I'm sure that at different points we had different positivity rates then that I don't think you can compare to now. But if you'll show the chart, and this doesn't have our most recent positivity rates on it that we showed before, this is what it shows you. It shows you that it's spreading more. And the positivity rate eliminates this concept of you're just testing more. It's how many people out of 100, the percentage are going to test positive. So what it says is that it's spreading more aggressively in Kentucky, or that it was 14 days ago. It says that this mask requirement, the steps we're taking, cutting down our barbecues or our house parties to 10 are really important, and I believe that they will work. I believe, based on everything that's being implemented in places that are in a lot worse shape than we are, that we've taken a lot of those steps already, and I believe that they will have an impact. But we got to know it's serious, and we got to know it's escalating. 4.92% is not where we want to be. It's up almost 3% from what we had, about a month and change ago. Tom?
Are you able to tell how the percentage of those who are asymptomatic as opposed to those who are actually sick that have positive results?
So the question is, are we able to get a number that is folks who are asymptomatic versus symptomatic? Not a good one. Because there are so many different symptoms, and we're still learning about symptoms, and the CDC continues to update their website about symptoms. I think mainly what we have in the data is how serious it can get with some people, right? The hospitalization data, the ICU data gives us an idea for parts of the population how serious it can be, but that's only if they go to the hospital. Everybody also has a different, you might say, pain tolerance or ability to deal with difficulty. We see some people that stay home having a tough time breathing and recover. We have others that go to the hospital with that, and rightfully so. But the asymptomatic, I know they put out estimates nationally. I think estimates are about the best they're going to be able to do, but we got to understand there's a lot of asymptomatic people out there. And we'll learn eventually, because it's a brand new disease, why it's impacting some people more than others. There's an article out there, and it's all early, and a lot of this changes about blood type maybe being something that could do it, but we don't know. And there's probably multiple factors that make it up. So nobody should read one of those articles and say, oh, my blood type is this, and therefore I'm less likely to get it, let's go to the bar. Don't do that. Student journalist at the Murray State News. With the new travel advisory, how should colleges and universities handle students returning to campus from those states? Number one, very carefully. Number two, with robust testing. Number three, in making sure that they have the medical staff on hand, ready to assist. They ought to have agreements if they don't have their own hospital with local hospitals to handle it, but they also ought to be talking to those students about limiting their exposure with the outside world before they come back to campus. And I know that those institutions are talking to our group in public health. One of the first plans I saw out, it's significant. Great thing about our universities is they're full of really smart people, and they're working real hard on those plans. Chris.
Yesterday you talked a little bit about the Ernst & Young contract. It expires in 4 days, and you told us that there were roughly 23,000 claims that were ready to be taken off the books. By our math, there's still about 44 or 45,000, and even if they finish with 4,500 a day clearing them off the books, by Saturday, our math shows about 30,000 claims will still be unanswered. Is this contract going to be extended, and how do you feel about their performance so far? Have they been able to meet your goals?
So the question is on EY, on the contract, on their pace, and on how many claims are out there. Originally, EY estimated that they would be able to help process 50,000 claims. I believe that they will hit that number. They've worked hard, they've extended hours, and you never know how difficult it'll be when you start. I think that they are going to hit all their metrics. With that said, there's still a lot of claims that are out there. And so we're going to look real carefully about whether we extend that contract, because they are getting a lot of work done. They are going to hit the numbers. Now, we've got to come back behind them and give the final authorization. And that's taken a little longer than I like, but it's getting done. It's a lot faster than we were getting claims done before. So, I think that there is certainly a possibility that we extend it, because remember, we still have so many new claims being filed. So the question is, you might be close to catching up, but how quickly do those claims outpace the number of people that we have? I've been, with the numbers reported to me, I'm not on the ground. With the numbers reported to me, it looks like they're going to hit those targets. And we're also going to have, if we think about extending it, people who are trained in our system, who are up to speed, and the pace has gotten better each day. I know they're over 30 as of today, and still think that they will hit that 50. I also think that some other claims that are out there, people who have received first couple payments and may have run into a problem receiving a third or a fourth, that those could be processed pretty quickly by this group too. So we're looking at that right now. We're trying to get exactly where we think they'll be by the end of the week. Even if they hit all their goals, which would be really, really helpful, we're still going to have a lot of claims out there, and I want to get caught up. I want to stay caught up.
When was the last time you spoke to Senator McConnell about potential CARES Act funding, and how confident are you that you'll get everything you need, given that just months ago the majority leader suggested that states should go back?
The question is, when is the last time I talked to Senator McConnell about CARES Act money? We haven't talked one-on-one, I want to say, the days now. Days feel like Groundhog Day. It's hard to tell. You wake up and you're like, which day is it? I think it's Wednesday today. It's probably been a month since we talked person to person. We're in touch with their office every couple days, one way or another. We're able to have direct communication. I think he knows how much we need this. We are going to set up, I am requesting a call since now they're finally discussing it again. I do have concerns. I have concerns that, at least in what sound like the initial talks, that there is not, at least in the you call it the Republican or the Senate plan, because the groups are led by different parties. It doesn't appear that there's direct aid to states, and unless we get flexibility on the previous money, that's a huge issue, and it would devastate us. Now, there's some positive things that are going to apparently be in there, like money for schools, but we don't know what the limitations on that money would be. So if you thought about it in terms of when we got the last CARES Act money, it's you can use it, but it's got to be directly related to COVID actions. So if what we got is that for schools, we could have robust testing, we could have a lot of hand sanitizer, that's great. But if we got to cut $1.1 billion from our budget, how much does that same building and the faculty and the number of teachers and all the rest suffer? So let's make sure if we're trying to save education, we save education, and that requires that direct budgetary support in one way or another. Let's see, question on, we're working on a follow-up on the upcoming end of the federal moratorium on evictions and the federal unemployment. Do I have an update on the status of evictions and foreclosures in Kentucky? There's a federal case filed in northern Kentucky. We've requested mediation. I think we're going to get all parties in it. My hope is that there will be productive conversations. The goal here is to make sure that nobody who's lost their job and can't pay their rent because of COVID is kicked out on the street when they need to have a place to be healthy at home. I think it's also fair to make sure that people aren't gaming the system if they have the ability to pay. Like all of this, it's a balance of fairness, and I hope that we can have a good conversation with the landlords we're talking to. Now, one thing I want to be careful of is that we don't set up a process with an imbalance of power in ways that get people in plans that are suffering because of COVID that aren't realistic. So those are my hopes, and now they know what I want out of the mediation ahead of time. I knew when I froze my legal degree I'd make mistakes.
With are scared.
Yeah.
They are, a lot of them have been listening to you and the lieutenant governor talk about how the numbers, the data will drive superintendents and you all choosing if students begin in person or on NTI. But the teachers I'm speaking with are concerned that their understandable fear is also not being considered. Can their understandable fear be considered if schools should begin on NTI or in person?
The question is on our teachers and their concern and whether their concern is being considered. And I hope every teacher out there knows the answer is yes. From the very day we started talking about what rules and requirements we'd put together, we tried to immediately dispel this belief that's put out there by some. Well, this doesn't result in the worst impact for kids, so opening schools is safe. No. Kids can spread the virus. Those teachers will be exposed to a lot of different contact because of those kids, and we've got to make sure that any reopening of our schools is safe for teachers. I think about them every day. It's why I'm watching these numbers. It's one of the reasons that I put this requirement for facial coverings in, and if we don't see a turnaround in the numbers where we are right now, they can expect some strong recommendations from me about when I think in-person classes should or should not start. But I hope they know out there that Jacqueline, the Lieutenant Governor, and I are thinking about them every day. I want them to be safe. I do not want any teacher to be put in a position that is unsafe. And even if it appears that it is, safe's a relative word in the middle of COVID, we want to make sure that steps are being taken for teachers who are at a higher risk. Even if others think that we can spread out and lessen the number of students, if a teacher's in a really high-risk category, we got to make sure that whether it's them doing NTI for other students, that we can meet those needs. But our teachers are being considered by this administration every day. But I get it. And if I was in their position with the uncertainty right now, I'd be concerned too. We understand and we feel that. Karen, did I get you or did I skip you? Okay.
We're hearing from a lot of people that haven't gotten their unemployment yet and are terrified that by the time they get it, they're going to lose out on that $600. Can you reiterate how that will work?
Yeah, folks whose claims have taken longer, I believe, are able to get the full unemployment at the time. I will check with our folks on that because that's a legal question, but I don't think they lose out on that $600. Now, let me say, I think it's a concerning time to stop additional payment on unemployment. I don't know what the right number should be, but you only get a fraction of what your salary or what you made before on unemployment. And I hear that there are some folks out there that are concerned that people might make more on unemployment than they did before, but if you just get a fraction of your salary and $600 makes it up, I worry about what you were making before. And whether or not we're paying people what they're worth. Well, we know we're not paying people what they're worth, but maybe this is a time where we can have true reflection on that and realize how important those workers are that show up, especially right now, all across our economy. We need to pay our servers more in our restaurants. Look at what they're doing now. They got to be pretty brave to go in there. And we need to take care of people a little bit better than we've been taking. Louisville health officials are saying not to get tested unless you're symptomatic or working in a high-risk job. Let me say I disagree. I think we still have enough testing capacity. Now, if you are symptomatic, call a healthcare provider at this point. If you are symptomatic, don't try to wait to get in the Kroger drive-thru. Don't try to sign up for something online. Seek direct medical help. We continue to provide tests to the hospitals. They have them in other ways. If you are symptomatic, get it that way. But the drive-through, I believe that needs to be open for everybody, and we need to know what portion of the population that otherwise we might not know is positive. Contact tracing doesn't work if the only people that we learn about are those that are symptomatic. But I know that there is a large appetite out there for testing right now. That's a good thing. It means that people are taking it seriously, and we've got to rise to the occasion. What we are doing is trying to increase testing from our state labs. But our challenge right now isn't the kits, though I think it's going to become in the future. And remember when we had trouble getting the swabs and the reagent, the liquid they were in? With the cases we're seeing in other states, we're worried there's a future where we're back in that problem. Our problem right now is getting the folks to work. Our healthcare professionals are already working, but you got to book someone an appointment, or you got to be there to help them do the test. You got to log it. You got to send it to the lab. You got to make the calls to let people know. So that's a logistical challenge, but we're going to meet it. Joe.
Earlier we talked about needing more flexibility with the previous round of CARES Act funding. Can you kind of expand on that and what you mean by that?
Right. So previously I talked about needing additional flexibility on the previous round of CARES Act funding. So our state got about $1.6 billion, but with a lot of strings and stipulations on how it can be used. And specifically, it can't be used directly to help for lost revenue from a state due to COVID-19. When a state loses revenue, what's impacted are the largest areas we spend money on. It's education and health care. And so there are significant areas where we're not going to have the revenue as it normally comes in next year to make up for the loss. And so while the best outcome for Congress would be a new round of CARES Act funding that we can directly use in our state and local budgets. I've just talked about the state, and that's my fault. Every local government's facing the same thing and needs the same help, and I'm encouraging Congress to give them the same help. But if Congress isn't going to do that, to say any money you still have left from that initial round, you can use directly for budgetary needs, that'd be helpful. I want to say that we have spent or allocated. See, we've got the budget. I believe that if they allowed us to directly use it, that we could still get, it's definitely in the hundreds of millions of dollars. To get you that final number, what we need to know is our final budget on testing moving forward. But it's not $1 billion. It's not 1.1, but we'd take at this point anything we could get. All right, we'll do a lightning round.
Where do you all see the sharpest increase in cases and
The question is, where are we seeing the sharpest increase? We're certainly seeing more younger people testing positive. The under 40, if you will, has gone up to a greater percentage when I look at it of our overall positives. We've seen an increase in kids under 5. I think that's because more kids under 5 are getting it, though we are testing more. And so, that's us based on a feel from the data, but without having really enough from before to make that direct comparison. Our clusters that we're seeing are vacation. You do get some business clusters, and the backyard barbecue, and then some sports. Now we're catching those, which is good, but we've seen a number of different athletic teams. We're seeing numbers in Louisville and Lexington, but we're seeing big numbers in Warren County, Barron County, and now we're seeing previously we'd seen the rapid increase in Warren County. That was the one that was most pronounced. We're seeing that type of increase if you relate it to the population of areas in more places now. Harlan and Bell County are good examples recently where we've seen a whole lot. Barron County now has a whole bunch too.
Not this militia group that's coming in this weekend, reportedly. What is your concern that you have people coming in from other states, presumably some hotspot states, and coming into Kentucky?
The question is for demonstrations or protests, am I concerned from people coming in from other states? Sure. I'm concerned anytime we have groups coming in from other states. My hope is that everybody will wear masks and will socially distance, and I hope that's a part of it. I know that most demonstrations we've seen are about life and respect for life, and a feeling that certain lives aren't respected. So my hope is that, knowing where we are with COVID, that any demonstrations or protests that move forward make sure that they are protecting the lives of everybody there and keep it from spreading.
Having all students take a test before classes begin. Are you encouraging that, and is the state helping other universities to do the same?
The question is on UK's opening plan that came out. I haven't been able to see all of it, but it has a robust testing requirement, and I will tell you that will make it safer. Now, if you test and you trace and you prevent, now I think Dr. Stack said it better today than we've ever said it, in that you can't test your way out of it, and a test doesn't prevent an infection, a facial covering does. But I thought UK's proposal was very thoughtful and even aggressive in a very positive way.
You may have answered this in the past, but I just want to make sure I know. If we see a sharp uptick again and you had to roll things back, what areas would you be looking at?
If we see a sharp uptake in cases, the next 2 steps that we will take are the steps that the White House has recommended that steps take, and that's rolling back restaurants to 25% and closing bars. We don't want to do it. The modeling, they say, from the White House says that it will be effective. And if we have a surge, we can't not do what all the national health experts and the Vice President personally has suggested. Those would be the next 2 steps. We've let the Restaurant Association know about that and know that we don't want to do that. And so, you like your favorite restaurant like I do, wear a mask. Social distance, we're now fighting for them too.
Adding to that, would it be if the uptick tomorrow, are you going to wait a 7-day 5 overall, or?
The question is timing and what we're looking at on there, and obviously we're looking at cases, positivity rate, hospitalization, ICU use, ventilators, and a few other indicators. We want to get to the point where we can see whether the people wearing masks and facial coverings makes a significant difference. That's probably early next week. Now, if we saw a dramatic increase, we might have to do other things, because again, when you take an action, you're only going to see 14 days later. And so in many ways, because of the way that we learn about the disease, it makes us always just a little bit behind. So if we saw a really large spike, we would act sooner.
About the availability of testing, are we looking at running out supplies anytime soon in that regard?
So the concern, the question is there a concern about the availability of testing? So we are not concerned right now about having kits and having labs. We've got a number of great Kentucky labs now that have stepped up and put us in a really good position. The question is, will they be able to get their supplies? So the test is really the swab, and I'm not as worried about the swab as the reagent, the liquid that you put it in, seal it up, and send it off to the lab. And just when you see 11 to 15,000 cases in just one state, all of a sudden there's a huge demand for testing, more so than we've ever seen. So am I worried about it? Yes. Are we taking steps right now? Yes. We've entered into significant contracts with at least one Kentucky lab, and given the size of that contract, we are pushing them really hard to get out there and get everything they need. But this is us looking forward, and we're at least at a place now where we're taking actions, not just aggressively, but proactively. Just like we have stockpiled PPE. We're actually pretty excited about where we are with PPE. If we have another surge, N95 masks are still the problem. There'd still be a shortage there, but otherwise we think we're getting close to a 2 to a 3 month, probably a 2 month amount on hand to where we could help supplement what the hospitals have held. All right, folks, we've gone just a little bit over time. Remember, cases out there are still escalating, but today I'm hopeful. I know at different days I've been in a different place, but I'm hopeful. We're seeing a lot of people out there doing the right thing. And we're seeing other people coming around. We're seeing people on the national stage wearing masks right now and saying it's patriotic, and I hope that people are seeing that. Let's make sure that we are doing what it takes. We have the ability to protect those that we love, to make sure we have an economy that continues to rebuild. We have the ability to move closer to our kids getting back in school. It's all on us. And let's remember, we're connected to everybody. Our failure to do the right thing, and whether you believe it's right or not, our failure to wear a facial covering and to stay 6 feet apart, it doesn't just impact us, it impacts everybody around us. So one of the best parts of my day today was talking to a big group of faith leaders and just listening to their perspective. They, like I, believe that doing the right thing here ought to be driven by our morals or our faith, our belief that we have to treat others as ourselves, and that at a time when our actions can impact so many others, it's truly living our faith. And there's a difference between being led by your faith, which I think is what's happening here, and using your faith to get where you want to go. Our faith tells us to protect one another. Let's make sure that we do that. We'll be back tomorrow. Again, given the number of cases that are out there, we hope that this amount of information is helpful. And take care of yourselves, take care of everybody else. Fill up social media with positive examples of what we're doing. It does help other people. Thank you all very much.